Let me know when we can start, and accordingly we'll start.
Please start in Matul, I am ready.
So are we good to start?
Yes, please start.
Okay. Good afternoon, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our renowned speaker for today's session, and is none other than Dr. Ash Sujit Ji. He needs no introduction at our platform, but yet I'd like to introduce him. He is the Senior Consultant in Gynecology and Obstetrics Department at PD Hinduja Hospital, Mumbai. With Sir's help, we'll be talking about today's topic, which is maternal-fetal medicine. Before moving on to today's session, let us have a brief look on what the topic says. Maternal-fetal medicine is a specialized field with obstetrics that focuses on managing high-risk pregnancies and the health of both the mother and the developing fetus. It employs advanced diagnostic techniques and personalized care plans to optimize outcomes for pregnant individuals facing medical complications or fetal abnormalities. So we'll be learning more about the topic with Sir's wonderful insights upon it. So now, without any further delay, I would like to welcome him at the forum and would like to hand over the session to him for his talk to begin. Sir, over to you.
Well, originally this topic came to me as when we were discussing about this is quite an interesting topic because in India still the concept of fetal medicine is at a neonatal stage. That is how I will put it. So when you go into the details and when you get into the studying bit, what it does different, that is what I am here to tell you about. We'll keep it very precise because this is a very long topic and this has to be there's actually a degree now which is given. We'll keep it very precise and I'll just touch on the important points that as obstetricians, as physicians, that you need to know where to involve a fetal medicine expert. So why this becomes important is because unlike obstetrics, where you treat the mother and that is the center of focus, in fetal medicine, the fetus is given the primary care, right? From screening to diagnosis and management of any fetal problem. Basically, this deals with clinical practice, research, education, and it has various advocacies and policies which gives the best fetal outcome also. And it considers a lot of fetal anatomy and physiology. Obviously, you need to know about them so that you understand any defects that are happening so that you can pick it up easily and you can find about it. So when you come into the evolution, this is how things have progressed. Obstetrics has always been there and it will be there, but we are doing something different. And these are the things that how it evolved. So amniocentesis, the first amniocentesis was done in 1952. And after that came the fetal sampling that was done in labor, that was 1960s. The first intrauterine transfusion was done in the year of 1963. And we all know Lilly's curve, which was there and which is there in RH incompatibility. So Dr. Albert Lilly was the first person who did intrauterine transfusion in RH incompatibility. We got the fetal heart monitors that we use nowadays for NST, CTG. So the first monitoring thing came at the year 1968. We had the first real-time ultrasound in the year 1971. And in 1981, the first open fetal heart surgery was performed in the University of California. After this, it took 10 years to actually have the first Congress of Perinatal Medicine. And this is where the World Perinatal Medicine was decided to be formed about. And that was the beginning of fetal medicine. For a basic example, like everyone has been doing it, in the past, we actually had just one single maternal serum marker, that is alpha fetoprotein, which was used to detect neural tube defects. Currently, you and I, we are all using different modalities. So we use ultrasounds to find out if there's any neural tube defect, which can be done in the first or the second trimesters. Plus, we have several maternal serum markers, be it the first trimester testing with the dual marker or a quadruple marker, which can tell us more about entities. Along with that, if there's any defect that is noted and if there's any diagnostic procedures that need to be performed, you're always ready to do karyotyping by amniocentesis or chorionic villus sampling. And nowadays, the current era is of free fetal DNA, where you can find out the baby's DNA circulating in the mother's blood, and from there you can detect any anomalies or any karyotyping issues in the baby. So who's a fetal medicine expert? Well, when it came to deciding who's an expert, when it came to finding out, so between 23 to 36 weeks, we had any issues which was tackled by a neonatologist, a pediatric surgeon, urologist, neurosurgeon, and orthopedic surgeon. Now combine everything and you give the mother this patient, this doctor, who is also good at managing the baby, obviously, because he's a fetal medicine expert. But apart from that, he knows about the baby surgery, which can be done, including the basic surgeries, the urosurgery, the neurosurgery, or orthopedic surgery. That doctor is a fetal medicine expert. And that is basically nowadays an obstetrician who gets into a different field of expertise and learns about this thing. Majorly, what he needs to know about is targeted fetal assessment during ultrasound and Dopplers, fetal blood sampling, transfusion, fetoscopy, and open fetal surgeries. So these are the basic things that one needs to perform, and one needs to be very well aware when you're an expert. In 1996, there was a concept which was developed by Brown, which was called the Madden concept. So what he had the concept was basically it was a acronym which has the multidisciplinary antenatal diagnosis and management. So if there's any issue which is picked up, you have a multidisciplinary approach at the antenatal level, so you can diagnose and manage any condition in the antenatal period. But then when you have a fetal medicine expert, all these things can be done by that one single person. So where is it needed? There are different scenarios where you might think of involving a fetal medicine expert. So if there's any high-risk pregnancy, then you can think of that. If there's early diagnosis of fetal abnormalities, then yes. Screening of any chromosomal defects, obviously, and development of safer techniques for prenatal diagnosis. So these are the conditions in maternal condition that you should think of getting a fetal medicine on board, because there might be certain issues which can affect the baby also. Preliminary, what we know about is diabetes and blood pressure. Yes, even my patients, we have a scan which is done specifically by a fetal medicine expert, because that doctor will give you percentages for the mother and for me, so that we can know if there's any risk which will be involving the fetus. Apart from that, kidney issues or any heart disease, then the blood flow to the uterus is compromised, and in such conditions, you might have a baby lining up with IUGR. So that is where this becomes important. Apart from this, asthma, obesity, IBD, or eating disorders. In cases of depression, cystic fibrosis, thyroid diseases, even sickle cell disease, which is very genetic and can lead to anomalies in the babies also, which is hereditary. So that is why it becomes important that the doctor scans for this thing. Multiple sclerosis, lupus, Seizure disorder, and even cancers. These were the medical conditions. Now it comes to the obstetric condition. Anyone who has had a previous high-risk pregnancy or a premature delivery, we need to find out what was the risk involved and if this would be complicating the present pregnancy. Persistent hyperemesis gravidarum. So you rule out if there is any placental involvement which is leading to hyperemesis gravidarum. Anyone carrying twins or more, because depending upon the type of twins that you have, A, you need to provide the comfort level for managing multiple pregnancy. B, you need to rule out some anomalies which can happen, which are specific for twins. In fetal growth restriction, so that you identify at which stage you need to deliver the baby. A baby's birth defect or chromosomal anomaly. Preeclampsia again. Placental problems such as placenta previa or placenta acquita. If there are any STDs which are there present during the pregnancy, and if there are any increased risk of preterm birth, such as preterm premature rupture of membranes or cervical insufficiency, and to manage complications which can happen due to heavy bleeding or because of elevated blood pressure, diabetes, or seizures, which are complicating the current pregnancy. So what do they do? What does a fetal expert do? Basically, the fetal medicine doctor does a level 3 ultrasound, which is very comprehensive with a lot of detailing that is given, not just on the scan, not just on the report, but even counseling the patient, which is very important. They can do a confirmation of pregnancy and a dating scan. The first trimester screening is done where they evaluate for the nuchal translucency, the nasal bone, along with assessment of any other fetal anomalies that can be present. An early anomalies can be done by them at 16 weeks if there's something which is suspected. Detailed anomalies can also be done, which is done routinely in India from 18 weeks onwards. You can get a fetal cardiography, which is done between 18 to 28 weeks to rule out any cardiac issues. Fetal growth scan with expected weight, like placental localization, which begins from 26 weeks onwards, so that you can find out any issues with this. Apart from that, fetal color Doppler studies, which can screen for IUGR and growth monitoring, they have special statistical monitoring software, which gives us a predictive value regarding the IUGR and whether growth would be uniform or whether there is a congenital defect which is happening along with it, or the time of delivery that needs to be planned out. And biophysical profile, which is begun from 32 weeks. Apart from this, they do fetal anomalies planning, which is structural or chromosomal. Cervical assessment is done so that you can think about doing a cervical stitch when required. Placental accreta spectrum disorder, so that you know that the placenta, if there's some defect in that, either it might warrant an early delivery, or it might warrant an obstetric hysterectomy, or it might affect the baby also. So the placenta accreta spectrum disorder. The dual and quadruple testing, which is done to rule out again any chromosomal issues. And if time needed, then amniocentesis, chorionic villus sampling, and fetal blood sampling, that is cordocentesis. They can even do fetal urine sampling, fetal skin biopsy, and placental biopsy in cases of certain defects which can be ruled out by fetal samples. And lastly, multifetal gestation reduction in cases of more than triplet pregnancy with selective feticide. Actually, this was the first case that I had seen with a fetal medicine expert, where there was a lady who had 4 pregnancies and she multiple gestations. So she was carrying 4 babies and she wanted, so we reduced it to twins. So that is what selective feticide was done. So this is done expertly because you need to not damage the remaining 2 babies, but then need to do it in a way so that the babies terminated do not affect the growth of the other baby and the pregnancy moves on smoothly till term. Apart from that, what do they do? So these are the important, great things that they do. This is what I have seen in conferences. So they can do a hysterotomy, which can be done in cases of meningomyelocele repair. This actually prevents any herniation or any development delay of the brain, which can happen. And with one surgery, they can just manage the outcome for the future. They can do fetoscopic techniques. This was the thing which led to the development, or which led to the fame of fetal medicine, where they did laser treatment for twin-to-twin transfusion syndrome. And this is where they started doing a lot of cases, and that is how their name and the fame increased. And that is how people started to come to know about a fetal medicine expert. They can do ex utero intrapartum treatment. This is something very interesting, where the fetal intervention is done just before delivery, but the fetus is still connected to the placenta. And this is done for major airway or respiratory obstruction, so that once the baby is out, you need to make sure that the baby can breathe on its own. Till then, the placenta supplies all the oxygenation. And in that phase, they do all the surgery if possible for the baby. Apart from that, intrauterine transfusion with RH immunization pregnancy, yes. Therapeutic amnio reduction in cases of polyhydramnios, yes. And fetal shunt surgeries, which are done again in cases of raised intracranial tension or any abdominal distension which happens, then so shunt surgeries can also be done. So coming to my last slide, what is the need for a fetal medicine? Well, you need to know a fetal medicine expert in your own practice, because if there is any anomaly or any abnormality which is affecting that pregnancy, they provide better information for clinical decision making, which will help you to provide better outcomes to the pregnancy, and also in parental counseling. Because eventually, if the parents need to know regarding the risk which is there in this current pregnancy, and the most important question that comes in, okay, this pregnancy has happened. What about the future pregnancies? Will it affect the other pregnancies also? Will it affect her life later on, or the life of the baby, or the outcome of the baby in the future? So all these things in total is given by a fetal medicine expert. So my thing is always, if there's any complication, I send it to my fetal medicine expert. He or she talks about all the risk involved, and they manage the baby regarding the ultrasound, regarding the counseling, and then at the time of delivery, I come in and then we carry on from there. The patient is also satisfied, the baby outcome is good, and eventually medico-legally, you have tackled it out with an expert so that you're also safe. Thank you.
Thank you so much, sir. Thank you for such a short and crisp presentation related to the topic that has been shared with you. Thank you so much for your wonderful insights upon it. We will take up the questions that we have received from the viewers. So the first question is, how can you detect problems other than chromosome abnormalities?
Problem that I'm looking at apart from chromosomal abnormalities, there's one which is very interesting and one of the favorite topics of fetal medicine expert is if you have a structural anomaly, supposedly like a congenital diaphragmatic hernia, if that is present, that will enter into your thorax from the abdomen, and that can lead to lung hypoplasia. Correct something like that in a very early stage so that the lung hypoplasia can be corrected. So then the baby has lesser chances of developing any breathing difficulty or any other issues later on once the delivery happens or even later on. So this is what a fetal medicine expert does apart from doing just chromosomal issues. That was just one of the examples. There are many which are there. So yes, it's not just related to chromosomal issues. It deals with, again, screening of pre-eclampsia, which is done nowadays by an expert. So my screening for IUGR, pre-eclampsia are all done by the fetal medicine expert. And like one of the examples that I get you, all these things are done by a fetal medicine expert.
Thank you so much, sir. Thank you for answering this question. We will take up the next question that we have received. And the next question is, what would you recommend, an amniocentesis or other diagnostic tests? What are the risks and benefits of it?
Okay, so nowadays, if I am suspecting that there is some anomaly that is supposed to happen, the cell-free DNA which is available where I take the mother's blood, and like I was telling you, the mother's blood has free-floating fetal DNA, and that can be tested for karyotyping, and that is one of the best things that I do, specifically for pregnancies above 35, 40, and if I'm have to rule out something major, so that is one of the things. If amniocentesis is required, it's quite safe these days. I do it in IPD basis. The patient is kept admitted because out of the tertiary care center, the patient comes in, the patient stays in for a day. Though it's a daycare thing, the patient comes in, we started with some tocolysis, we do the amnio, the ultrasound, the fetal medicine expert does the ultrasound, avoiding any damage to the placenta or the baby. And again, tocolysis is continued, antibiotic is given, and this is very safe. It is much safer. Amniocentesis is much safer compared to if you need to do a chordocentesis or chorionic villus sampling. So I would suggest amniocentesis is obviously something which is safer and can be done. If you're suspecting something which is gonna complicate the pregnancy in the first half itself, then think about the cell-free fetal DNA in the mother's circulation. That would be something wiser that you can do, and a routine screening for with ultrasound.
Thank you so much, sir. Thank you for answering this question. We will take up the next question and the last question for today's session that we have received. And the question is, are there any recommended procedures for this diagnosis that you would recommend?
Recommended procedures for diagnosis would be, see, there's no procedure which is done. So once you do, so basically you start with doing ultrasound. So ultrasound is something which is your mainstay. Most of the fetal medicine doctors prefer. So they do a proper ultrasound, which is called a targeted ultrasound or anomaly scans, which are done by them. And if they find something, that's the procedure which they do. If there's amniocentesis which is done, it is a very basic thing, which I guess all the doctors have learned or shown or have been a part of it. If there any other procedure, like we were discussing hysterotomy and doing a surgery or a fetoscopy, that is quite challenging. Per se, I don't do it. My fetal medicine expert, he does it routinely. They do it at a hospital which is known for their fetal medicine care and their neonatal care. So they do it out there. So procedure-wise, the major thing is your clinical history, which is very important because you need to counsel or guide the patient regarding the risk involved. Ultrasound and talking to the patient regarding the outcomes. So that is what you basically need to do before any procedure.
Thank you so much, sir. Thank you for
Thank
answering that
you.
question. That was the last question for today's session.
Thank
And
you.
at the outset, I would like to thank all the viewers who were here with us throughout the session, and to you as well for taking out your valuable time and for being here. And this particular session has been rescheduled. So
Yes.
thank you for bearing with us and for taking out your valuable time, sir. Thank you so much for that.
Thank
So
you,
without
Batul.
any
Thank
last
you, everyone.
comment, we can conclude the
Last
session.
comment would be always know who's a fetal medicine expert around you. Keep that person in loop. It's very important medical legally in today's era that you need to have someone who's backing you up, because it's not just arbitrary, and obstetric and maternal outcomes and deaths are something very dangerous for any obstetrician out there, any doctor out there. So have a doctor who has a knowledge and who does procedures like this and can provide you better outcomes. So that will help you also give your best outcomes to the baby, and again it makes sure that you're